Appreciate it. Hi, everybody. Um, can't believe we have such a big group here. I'm super excited to be chatting with you all. We have, as Allison mentioned, I'm a physical therapist with Pappas OPT. Our partner brand is out of Rhode Island, little tiny Rhode Island. We have 17 locations throughout the state, and we service the state with both physical therapists, occupational therapists, and physical therapist assistants as well. What we were hoping to do to start is I have Lucas here, Lucas Ackerman. Lucas has been a PT with us for coming up on a year, a little less than a year. Lucas, I'll let you introduce yourself as well. And we were thinking of starting just kind of talking a little bit about Orthopedic Residency Program and kind of the benefits of that. Like Allison mentioned, getting down in the trenches and the nitty gritty, like how do you balance that with the patient caseload? What impact and value that can potentially bring to the table as a new graduate physical therapist. And then I have some questions I'll ask Lucas. I'll let Lucas kind of talk about his experiences, and then feel free if anybody has any questions related to a residency program, feel free to throw it in the chat, and we'll have some time at the end to hopefully answer some questions. So Lucas, welcome. First, can you just introduce yourself, give a little background, where you went to school, how long you've been with us, and when you started the residency program?
Yeah, so my name is Lucas. I'm a PT. I graduated in May of last year, so just coming up on a year. But I started with Pappas part-time in July and full-time in August. And I went to Northeastern in Boston, and I did a 6-year program there. And as we'll talk about later, I'm in the second of 4 of like the core courses in the residency, which I started January 8th.
Awesome. So just before I go into some of the questions, I feel very fortunate, and we feel fortunate at Pappas OPT to have the partnership with Confluent Health, and specifically through that partnership, be able to work with Evidence in Motion. We really value the ability to offer our clinicians the ability to work towards a board certification. As Allison said, as a company, it's something we put a lot of emphasis and kind of power behind. We find that board certified therapists really are experts in the field, right? They have the highest level of competency and confidence when it comes to orthopedics, which is what we do. Obviously, orthopedics isn't the only board specialty, but given that's kind of primarily our field, we'll primarily speak to that. We encourage our clinicians to work towards that because of the benefits it brings. In order to sit down for the board certification exam, you're required to have at least 2,000 direct contact hours or to complete a residency program. And that's what Lucas will kind of speak to a little bit more. Just to go over kind of some of the other options that we offer in addition to the residency program that can kind of get you to that board certification, we offer, our Evidence in Motion offers a manual therapy certification, which is a little bit shorter, slightly different workload as far as courses. It's typically a year-long program, and that, in addition to a OCS prep course or board certification prep course, can get you prepared for taking your board certification. The other option we've offered, which is a little bit different, is just taking kind of the core 4 management courses that are kind of the foundational courses of the residency and the manual therapy certification. So those include management of the upper extremity, management of the lower extremity, lumbopelvic, and cervical thoracic. We host those courses in-house. We have our clinicians take those. They can take those weekend intensive courses, take the OCS prep course, and then sit for the OCS exam once they've had enough direct contact hours. So we try to realize and acknowledge that it's not a one-size-fits-all. I think as you all are looking to graduate, some people are ready to jump and dive right into a residency program. Others might say, all right, I want to get my feet wet. I want to start treating some patients. I don't know if I'm ready to commit to, the additional work and energy that's required. I just finished school. I don't know if I want to jump back in. I think there's value in doing that, but we certainly acknowledge not everybody's there right away. So we try to tailor what we offer to accommodate everybody based on where they are. So Lucas, can you just give us an overview? I know you mentioned you're in the second management course. Can you speak to what coursework you've had to take so far as part of
Yeah.
your residency program?
I think kind of talking about Dan was talking about how there's the option of just doing the core 4 classes, which is the lumbopelvic, the cervical thoracic, upper extremity, and lower extremity classes. And that's a lot of what I've felt so far is like the big portion of the residency. But the one thing that you get if you do the residency that I have found so helpful is we do this virtual rounds class, which I'm also in the second portion of, which included me kind of talking through an eval that I did. And I got to kind of share with my thought process and had some of the teachers have done the fellowship and some are just other board specialized certifications, and they kind of talk you through the case and they try and figure out what your thought process is with that, which has been very helpful. And you get to also sit in on your peers and hear about how they think through their cases. And then on top of that, the other kind of extra classes that you get, there's a large medical screening class that you take in your first quarter, which is super helpful. Like especially in this world of direct access physical therapy, like getting some of that more hard skills that especially like coming out of a DPT, you already know a lot of, but it's kind of an extra run around where you're treating patients and you're seeing these things and you're just getting kind of a re-education on some of those things, as well as there's an imaging class that you take. And then there's a post-surgical operation, a post-operative course that you take later in the curriculum.
Awesome. So you specifically have found value in those virtual rounds classes. I know from what I've heard from other residents recently, it can be nerve-wracking, right?
Mm-hmm.
Like kind of preparing your cases for that. But I think you speak to the value of like, all right, you're able to present that case, get direct feedback from faculty, from fellows in orthopedics that can really help hone your skills. So that's awesome. So, going backwards from when you graduated, were looking to accept your first job, was getting into a residency program something you thought of right away, or was it more of an afterthought once you started working with us?
So when I was in school, I really thought I was going to be in a residency, or I wanted to go into a residency. And then by the end, I think some people might be feeling is like kind of getting overwhelmed with school, and you're like, I don't know if I want to. But then I went out and I was interviewing with Pappas, and they mentioned that there was an orthopedic residency. And I really wanted more kind of structure to starting my my career, especially kind of the one thing I've liked about it is that I've been able to have these, like we learn a lot in PT school, and you give all these perfect cases and perfect situations, but then you get out and nothing's perfect. Everything is a little bit different than it is. And so you get to really use these skills that you learned, and you're relearning a lot of the same stuff with just a higher kind of degree of thinking. But you get to do it while you're treating in the clinic. So you finish up at night with your coursework, and then the next day you could use some of the pain science or some of the techniques that you were learning about in your online courseworks with the patient you see first thing the next morning. So it's kind of a nice being able to fully use what you're learning in the moment instead of having to wait until after you do all your coursework in PT school to get into your clinicals. So it's like a kind of a second over of all of the material one more time, especially directly related to orthopedics.
Awesome. So one thing when I talk to either new grad PTs or younger physical therapists, I think one of the challenges specific to like evaluations is time management, kind of going through an evaluation efficiently but still being thorough. Can you speak to any of the benefits you've found going through the residency so far and how it's impacted your ability to kind of like efficiently evaluate a patient?
Definitely. I think right now I've gone through 2 of my courses. So I feel like really, really confident with my cervical thoracic and my shoulder, or my upper extremity, excuse me, evaluations. It's really helped me with kind of my increasing my confidence, and kind of my efficiency with the time management. I think a lot of times these courses kind of break down a lot of the diagnoses and put them into certain buckets to kind of streamline your hypotheses and kind of help you find something so that you can get and help that patient on that first day, which is always so helpful. And you can get into a treatment and you can help that patient so then they can come back and you can continue working with them. And it's definitely made me more confident in being able to identify what I need to help that patient with day one to kind of kick start my treatment going forward, which is something that I started my residency I think 3 months after, and as soon as I started my residency, I felt a lot more confident in those situations, especially with the management courses that I've already taken.
Yeah, that's great. I know that's something that I remember as a new grad myself, like that first evaluation, I'm like, oh no, there's no CI anymore. There's nobody to lean on, right? This is just me. So yeah, I certainly can acknowledge having that, like you said, those buckets, right, to help
Mhm.
streamline your approach and help with the clinical reasoning during that time is beneficial. So I know you mentioned, we have the weekend intensive courses, which are really lab heavy, right? We do a lot of hands-on practice, and then you have the online hybrid courses as well, where you have some discussion boards and articles and things like that. Can you speak to, I guess we'll start with the weekend intensives and
Mhm.
any specific value you found from those?
I think my favorite thing, I think I just had a weekend intensive actually this weekend, and my favorite thing was that it's very different also than in school when you're in labs because we have a fellow in training in our company right now, and then the teacher, it allows you to kind of talk to them and take if specific cases that you have that have to do with these skills, and you can kind of bounce ideas off of them and talk to them about that. And it's very much different than like a lab where it's just like you learn this special test, then you learn this special test, this technique. It's very much a community event where there was people from New York, and there was my first ever weekend intensive I took. There were people from Florida, and they all kind of come together. You get to learn about all these different things from different regions of the country, because every region also has its own specialties. So you kind of learn all these different skills and these different techniques that will kind of you can bring back to your own practice. Or maybe you've seen a surgery that you've never seen before, but that's so common in Texas. You kind of get the background of what that is going on in there, and you build more relationships than just learning the skills again, but also learning all the skills on top of that.
Yeah, I would imagine it's a little bit of the meeting of the minds, right? Because you
Yeah.
have everybody's coming in with different experience levels, like you said, see different diagnoses. So in addition to the knowledge you get from the instructor, you get the ability to kind of brainstorm with other people in the room. Yeah, that's great. Um, so one of the challenges I remember kind of when I was going through prepping for the OCS is the balancing act, right?
Mhm.
You're a full-time treating clinician, you have a full caseload, you also have a lot of coursework and content that you're working through for the residency. So how have you worked to try to manage your time effectively to balance those two things?
I think it really, I can say that personally, I don't have the greatest time management skills, and I think joining the residency was something that kind of helped me kickstart my time management skills. And if I can do it, anyone can because it's not one of my strengths, but it's definitely been a lot easier than I thought it would be. With the residency, the first quarter is a little heavy, but as you kind of go forward, you get used to it, and you kind of keep going forward. And again, it's almost it is separate, but at the same time it isn't because I'm learning all this stuff and using it, and so it really does kind of flow well and mesh well, especially when if you work at somewhere like Pappas where there are people who have done it before, you kind of it's a way to kind of connect with a lot of the people. And oh, it's not it's a kind of I'm trying to think of the right word. It's very doable, and it's not like too many hours, and you can kind of fit everything together if you kind of take it one week at a time, and it's very well organized. It's not like they throw everything at you once. They break it down to weeks, and it's kind of they break it down to manageable chunks, which has been very helpful and effective.
Awesome. I don't know if you're giving yourself enough credit. I think you do a pretty good job with your time management skills, Lucas. Um, so what looking to our group here, who I know are a lot of students, what advice would you give to somebody who maybe is considering a residency program after graduating?
um I think it's something to definitely take a look into. I think that it can seem like overwhelming at first. But personally, I'm doing the residency, and then one of my great friends from school is also doing residency. And it's kind of this thing that we've talked before, and we both are learning to grow so much. And you start kind of at this place where day zero, I kind of felt like I was very confused, and but as I kind of built through the residency, it kind of gave me a structure to um build on top of. I was talking to someone this weekend at the intensive that was someone else. He's in the fellowship, but he was like, if it's something, if you like structured learning, the residency is a great way to kind of keep building that structured learning to build from day one as a day one clinician to kind of hopefully going through to get your OCS, and then kind of leaping off from there. It kind of is a little bit of extra ladder that you can kind of help yourself climb with.
Awesome. Yeah, that's great. And I know one of the things you mentioned earlier is the confidence, right? Like that's something I've seen in myself from going through some of the coursework, and also seen in a lot of our younger clinicians, the difference from day one when you start as a entry level PT, you start working through the residency, and you can kind of see that confidence grow. And you mentioned it's a little bit busy and chaotic and kind of like all over the place when you start as a therapist. And in addition to the confidence, I think what I've seen in you and with some of our other new grads is the structure it's created with, despite having a busy caseload, despite having, a lot of patients in the clinic, you're able to create structure because you have efficient ways to evaluate them, create treatment plans, and kind of carry out those interventions. So that's awesome. I'm glad it's been helpful. And thank you, Lucas. Thanks for sharing your story here.